Welcome to Raise the Line with Osmosis from Elsevier, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the pandemic and beyond.
Hi, I'm Shiv Gaglani. Our special focus on rare diseases continues today with a look at a 1 in a million immune disorder called Hyper IgM syndrome, which compromises the body's ability to produce responses to pathogens such as bacteria and viruses. Most people with the condition will die before they reach their 30s. Our guest today, Akiva Zablocki, learned all of this the hard way when his infant son, Idan, was diagnosed with X-linked Hyper IgM, also called CD40 ligand deficiency, in 2013. Thanks to the love and persistence of Akiva and his wife Amanda, Idan has received multiple treatments and is now 10 years old and quite healthy. In order to help other patients and family members fight this rare disorder, the Zablockis founded the Hyper IgM Foundation in 2015 to improve the treatment, quality of life, and the long-term outlook for children and adults living with Hyper IgM through research, support, education, and advocacy. And the way I got connected to Akiva was the Hyper IgM Foundation actually posted the Osmosis video on the condition, and I reached out to him, and he was very happy to give us productive feedback on the video, which we edited with him and his colleagues' input. And he's been great at connecting us to other rare disease groups, including an original connection to the National Organization for Rare Disorders. So Akiva, thanks so much for taking the time to be with us today.
Thank you. Thank you for having us.
Now, by the time your son was born, you were pretty familiar with the healthcare space, having worked as a consultant to Fortune 500 companies on their health and wellness plans, and you had earned a master's degree in public health from Columbia. What led to your interest in healthcare in the beginning?
That's a great question. Looking at my background before I switched over to health, there was no indication that I was going to go into healthcare. But back when I was in college, I was an economics and philosophy major at Columbia. I'd been making plans to go work in finance. In the summer before my senior year, which was, really had a lot of plans. I had just been elected to be senior class president. I was spending the summer in Israel traveling. And that's when I was very surprisingly diagnosed with what the doctors were calling an inoperable brain tumor in my brainstem. So with that, my whole plan for my future kind of got thrown off track, I would say. Most patients in my situation would probably go see a couple of doctors and kind of make a treatment plan. In my situation, the first few doctors I saw were telling me that my brain tumor was, in fact, in my brainstem, entirely encompassed there and inoperable. So they were offering me some chemotherapy treatments, radiation treatments, but most of them didn't have a lot of faith that they would actually be able to get rid of my tumor. And I was basically given 2 years to it. And so at that point, I hope everyone would do was they continued seeing doctors. And I probably got around 30 opinions from neuro-oncologists, neurosurgeons all around the world. I was based in New York at the time, so I had access to a lot of great medical centers. But most of them were telling me the same thing I had heard before. Besides one doctor in Phoenix, Arizona, that told me right off the bat, come down here, I'll take your tumor out. I'll give you a 95% chance that I could do it, and you'll have a long life. So taking that information and then going back to the doctors in New York, I'm like, is this guy crazy? Is he, why is he doing something? Does he have sharper knives? I mean, and everyone was telling me, there are always going to be a cowboy out there that could, that will offer you something, but that's, it shouldn't be possible because again, you have to cut through your brainstem to get there, and they'll probably, if they don't kill you, they'll leave you in a wheelchair for the rest of your life, with a feeding tube. Being 25, being young and not having responsibilities, I was willing to then just take the risk and try to save myself. So I flew into Arizona, had my brain surgery with this Dr. Robert Spetzler in Phoenix, Arizona, and he was right. I mean, he succeeded. He got the whole brain tumor out. He left me not in way worse off condition than I was already. And that was, I think, 17 years ago. So I spent 11 days in the ICU recovering, and then a long rehab process, learning how to walk, talk, get back on my feet again. And it was during that rehab process at Rusk in NYU that I kind of realized that my whole life plan was kind of going to be different. I mean, I realized that what I went through, I wanted to try to help other people who might be in the same situation as me become empowered and make the best decisions that they can make on their treatments. So came up with a lot of ideas of how I could change the oncology world and the brain tumor world, and decided to change my focus to public health. So I went and got my public health degree at Columbia, and then went into work in that field.
That's incredible. We're so glad you're with us today, and obviously all the people and companies you helped along those last 17 years certainly have been blessed by that surgeon and the fact that you didn't give up. We normally ask this question at the end of podcasts of advice you would give to current and future healthcare professionals, and we can return to that after we start talking about your foundation work and Idan. But before we go into that, given that you were on that side as being a patient with a very serious condition where a lot of physicians told you there's nothing to do, what advice would you give to medical students, practicing nurses and doctors, et cetera, about bedside manner or anything else that really helped you and stood out when you were going through that serious period of your life?
It's a good question. I think from the medical side of it is not to discount the patient as a stakeholder. I mean, when you talk about healthcare, there's always like you see places where they say, well, we're having a conference and we're bringing all the stakeholders to the table. We have pharma, we have insurance, we have industry, we have the doctors. And the main stakeholder in health is always the patient. They should be the center. So a lot of times it's like, if a patient comes with doing their own research, I mean, maybe it's different now, but back in 2005, we printed the internet back then, right? There's no smartphones. So, and a lot of times the doctors would discount the research that we had done beforehand. And my family and I were doing a lot of research, and we were pulling studies. And even though we didn't have a background in understanding these studies, we pulled studies and we had information about this surgeon that was doing, he had published over 100 brainstem surgeries already. But most doctors just discounted it because they know their field, and it's hard for them sometimes to understand that other people might be doing something different. So I think from that perspective is always is to give the patients a little bit more benefit of doubt with what they kind of know. And if you see a patient that isn't in that point, I mean, help them understand what they should know and what they should be looking into.
Absolutely. And, it's definitely a focus area of ours on the so-called soft skills, things like shared decision making and how to approach those conversations and ultimately keep putting the patient at the center. It's one reason we've been attracted to the rare disease space for so long is because when you meet a parent or a family member or a rare disease patient themselves, they truly know more than the average clinician about that condition. They not only live it, but they've taken it upon themselves to, read the articles, understand it, start foundations, as in your case. So let's transition into that, an empowered patient or family member perspective. Tell us about your son, Idan, and kind of how the diagnosis went, and then ultimately starting the Hyper IgM Foundation.
Sure. So my first son was born. He was born healthy, went through all the newborn screening tests perfectly, reaching all his milestones for the first 6 months or so. And everything looked normal. Around 8 months, he started getting a little, he seemed fine, but he started breathing quickly. Maybe he had a mild cold. We didn't notice it. My mother-in-law noticed, he's starting to take a lot of breaths a minute, and maybe we should go to the pediatrician. Which we took him to. We went a couple of times that week, each time thinking it's just a virus. He's healthy. Besides that, as the couple of weeks went by of going back to the doctor, his oxygen levels fell. His breaths, he was definitely taking many breaths per minute, struggling really to get a good breath in. And at that point, they rushed us to the ER and started probing him and testing him and seeing, assuming that it was some sort of pneumonia, based on the X-rays, but they really didn't understand what it could be. And the first couple of days there, he just went to a breathing mask, and then eventually they intubated him, and he ended up being intubated for 2 full weeks and diagnosed with pneumocystis pneumonia, which is a very rare pneumonia. It's an opportunistic infection that you will not get unless you had a compromised immune system. So at that point, all the doctors kind of descended on us, and we saw infectious disease. They tested him for HIV, obviously, which he was negative. And then they started going through all the different tests for different kinds of immune deficiencies. And at that point, it was kind of like it triggered what I like to call it, I've been through this myself, and like you would say, I've been through this boot camp of dealing with a rare diagnosis and trying to find an answer. So all my like skills that I had, developed during that time and over the years in public health, kind of jumped in. He was in the ICU for 3 weeks, and that's when they discovered that he had no antibodies at all, never made any response to any of his childhood vaccines, and they started giving him IVIG, which is intravenous immunoglobulin dosage, and started sending out tests. And he came back with a immune deficiency called CD40 ligand deficiency, which is also called X-linked hyper IgM syndrome. It's a very rare 1 in a million type of immune deficiency. Patients with this immune deficiency have defective T cells and cannot communicate properly with their B cells. So they can't alert the rest of the immune system to pathogens or viruses, and they can't signal the B cells to produce antibody response. So if you get a vaccine, you don't make any response to it. When you get a virus, the B cells won't do anything to fight them off and won't produce antibodies. Only some of the T cells might work. So being a 1 in a million disease, there wasn't a lot of information out there at the time. There was one page on the Immune Deficiency Foundation's website, which is a great organization, but focuses more on the more common immune deficiencies out there. And most doctors you meet would never have heard of hyper IgM syndrome. Maybe it was on a pop quiz during their immunology class, the one immunology class I take it in medical school. And so that's when we started, to get into crisis mode. Our son was, being immune compromised, we really couldn't be around people. We kind of like sheltered in place back in 2013, before that was even a term. Everyone coming over, we put masks on them. They changed their outfits. I was wearing a mask every time I felt a scratchy throat back in 2013. So we kind of learned to be aware of germs and all of those things early on. And with hyper IgM syndrome, the only known possible treatment that could be a curative treatment is bone marrow transplant. So that's kind of like what we knew we needed to do. And then the question for us was, what type of transplant, what type of chemotherapy protocol, and where we would do it. So similar to with my situation, we started consulting dozens of centers and going around the world and the country, trying to find the best treatment that we can for it. Along the way, and this is kind of leads into the foundation work that we've been doing. Along the way, we got a lot of attention from a fundraiser that we were doing at the time to raise funds to cover his treatments, because the insurance company had denied his IVIG treatments and were denying also the transplant at the beginning. So we were raising funds, and that's kind of when we got a lot of news attention. And that led to patients around the world reaching out to us saying, oh, we were always told, we would never hear about another patient with this disease. And then we saw the article or the news on the news about you. And so we realized that there's a community here that could be built. And we were probably situated in the best possible place to build that community.
Absolutely. I mean, what a remarkable kind of journey you guys have been through. How is he doing now? How old is he? And can you tell us a bit about that? And then obviously I have a ton of questions about the foundation work and whatnot.
So Idan is 10 years old now. He is doing amazing. So he had transplant back in 2013 when he was 14 months, which unfortunately failed. We went out we after doing a lot of research, we chose to transplant him, even though we lived in New York, at Seattle Children's Hospital. And the main reason is when you're going to do a bone marrow transplant or stem cell transplant, you need to get a high dose chemotherapy to kind of wipe out the organ that you're transplanting, which in this case is the bone marrow. There's no way of getting all the bone marrow out of your body besides giving chemotherapy and immune suppressants. And Seattle had a protocol that nobody else in the country has, and they still have a protocol that no one else has, which is a type of chemotherapy called treosulfan, which is just as effective in wiping out the bone marrow, but less toxic for the rest of the body, which is why one of the reasons we chose Seattle. Fortunately, his first transplant failed, and it took us a few years to kind of realize that we needed to do it again because his hyper IgM basically came back. And then he was transplanted again in 2016, right before he turned 4, and it was a success. He's been living basically disease-free for the last 5 years, off all medication, off all infusions, going to school, really normal life. I mean, he spent the summer at a horse camp, like shoveling manure and tending to goats and animals and horses. And so we're not worried about him at all anymore.
That's amazing. And so similarly, throughout the COVID pandemic, has it been relatively normal at your household?
So that's a great question. So at the beginning of the COVID pandemic, we kind of, we had just spent several years trying to stop Purelling our hands and stop being, so neurotic about germs. And then all of a sudden it was like a PTSD flashback to that world. So we went and became, probably more neurotic than other families at first. I think we're one of the few families out there that have not had COVID in the last 2.5 years. So maybe everything we've been doing, but he's been vaccinated. I mean, he's unmasked now in camp. We're not worried about it. We were told at first going through a bone marrow transplant, it means a lot of, chemotherapy and poisons on the body. So we wondered how well he would do, but we were assured by his medical team that he would do just as well as any other kid his age. So we weren't concerned about him, more than the average, which is very different in the community with Hyper IgM because they are very concerned because they all are all immune compromised unless they've had a successful bone marrow transplant.
Yeah, no, that makes a lot of sense. And actually, can you talk to us a bit about the bone marrow transplant too? We partner with an organization called Donor Alliance, and recently had them on the podcast about bone and soft tissue transplantation. And one of the main takeaways from that is for our audience for not only to sign up themselves to be organ donors and for these registries, but then also to have those consultations with patients as well. And we also had people like KX Jang, who runs Facebook or Meta's health platform, and they've done a ton of blood donor drives and other drives to raise awareness, which is one of the things that happens, but I haven't heard of a bone marrow drive in a while. So can you tell us about the process of getting that, how you got matched, any of that stuff?
I mean, I would say that being a bone marrow or stem cell donor is probably one of the most amazing things you could do. And it doesn't take a lot on your end. Many of us get swabbed in college or at some event that we go to, and we never think about it again. I know I was swabbed in grad school, and I never really put much thought into it until my son needed a donor. We were very lucky that my son's HLA typing was common enough, I guess because my wife and I have the same kind of genetic background, both Ashkenazi Jews from the same region in Europe, that we had a decent amount of donor options when we were choosing, and they chose the best optimal donor for the first transplant, and then they switched to a different donor for the second transplant. But I would say that there are a lot of patients out there that do not have that access. Anytime there's a patient that any kind of mixed race or even just mixed ethnic backgrounds, it would be much harder to find a donor match. We were very fortunate, and actually we got to meet my son's donor a couple of years after his successful transplant. We had asked to meet him because he was doing well. It was 2 years post transplant, and then the registry, which was the Gift of Life registry that he was found through, said, "Oh, you know what? We have a perfect thing. We're going to have you guys meet him at our event." And we went to an event in 2018, I think it was. It was a 500-person gala, and they had a video about Idan and his story, and then we got to meet his donor Alex on stage in front of 500 people, which was a very big emotional journey for us, but it was very special. And Alex was an amazing guy. He registered when he was in college, kind of forgot about it, and when they reached out to him, said, "Hey, you could save a sick 4-year-old that needs your bone marrow." He jumped in it right away, and it was a very easy process for him because they could take out stem cells now. So you just sit in a hospital, you donate blood for 6 hours, you get the blood back. They just take your stem cells in the end, and then they shipped him to Seattle, and he saved our son's life, and now they kind of share a special bond, and we've kept in touch with him since.
That's incredible. Yeah, we love hearing those stories, and we, if there's any recording that, we'd love to share them in the show notes.
Oh, sure.
So going into the foundation's work, this is a 1 in a million type condition. There's 8 billion people in the world, so really only 8,000 people. So it's any rare conditions are less than 200,000 people. That's the criteria. This is even more rare than the average rare condition, it seems. Tell us about the foundation. How do you, what are the types of activities you've been working on, and any kind of highlights or things you're very proud of the foundation having accomplished since you started it?
I mean, we're what they call an ultra rare condition. There's only probably a few Hyper IgMs born every year in the US. We started off with a support group, just organizing families together, kind of connecting them, because we realized that every time another patient with this 1 in a million disease that was told that he would never meet another family with disease unless it's in their family and they know their cousin has it. Once we brought them together, so much more information was being shared and empowering patients to make the better decision. And that's when we realized that we could do so much more. I had an extensive background in healthcare and also sitting on the board of a national foundation for 10 years in the brain tumor world. So I kind of knew how charities would work. And then my wife, Amanda, is a healthcare attorney. So we were really situated in the best possible place to start this foundation for these families. So we founded in 2015 with the goal of connecting families together and also raising funds to help research and hopefully cure this disease. So besides connecting families and helping new families all around the world kind of understand it when they're first diagnosed, we connect them with the patient liaison, we have a call with them, we connect them with the support group. We just really help them understand this diagnosis, and most of them are being diagnosed kind of out of the blue. Their son like ours would be totally healthy, and then all of a sudden get sick and get this rare diagnosis and not knowing really how to process it. So we created a website. We put a lot of information that we simplified for our patients, kind of like what you do with Osmosis. And I know that we connected because you made a great video on Hyper IgM syndrome, which we've shared with all our patients, which is amazing. And so we help them in that aspect. We also help them connect to the best care. So if there are patients in India or any place that really that might not have the best options, we'll connect them with families. I mean, we've had families in Turkey that we've connected to, in Australia that we've connected because they haven't had the best option, and we'll connect them to a expert in the UK that they could talk to, and then he'll talk to their doctors and kind of make a treatment plan. And we've had patients all over the world kind of change their treatment plan based on the connections that we've made for them with experts in the field. And we've also been raising research funding every year, giving grants to hospitals all around the world that will focus on understanding Hyper IgM better. But the things that we're most excited about for us is the gene editing and gene therapy options that might come into play. So we don't have a treatment now. The only thing that we have now is kind of prophylaxis care, which is IVIG treatment, and our patients could stay in that for life. But the median age is still 24, unfortunately. So most do not make it past the third decade of life. Or if they have a match and they're healthy enough, they might have a bone marrow transplant. But the survival rate with bone marrow transplant is also not amazing. I mean, you're rolling the die. There's a 10 to 15% mortality rate with any transplants. And besides that, the success rates aren't always that amazing. So the treatment options with the gene editing would be amazing. And there's a couple of centers around the world that have been working on this, and we've been helping both fund them and also get them patient volunteers to be part of their research.
That's incredible. And actually that's exactly how we got connected. Was I was following where Osmosis videos are being shared, and I noticed a lot of traffic on from your Facebook page, the Hyper IgM Foundation, and reached out to you because we had just started working with rare disease foundations like the Alpha 1 Antitrypsin Deficiency Foundation, and you were very generous to give us a lot of feedback on the video. We improved the video, and then very generous with your network. You reconnected me to Nord, who I had met first at a conference, but then you knew them very personally, the National Organization for Rare Disorders, as well as other foundations. So we appreciate kind of the role you've played personally in helping Osmosis get bigger into the rare disease space. So on that topic, real quick awareness, right? So once you got the news articles, there was raising money for the foundation for Idan, you started hearing from all these patients and family members who had this condition, and that's where you start getting the numbers you need for not only raising money but also for clinical trials and getting more interest. This is something we really want to do at scale for many patient foundations as well. NORD's 40th anniversary and the anniversary of the Orphan Drug Act is coming out next year, and I'm just curious if you found that working with other foundations, working with maybe there's Hyper IgM groups in other countries, is it very collaborative? Like, how do you feel the ecosystem has evolved since you started the foundation yourself?
So when we started it, I mean, there wasn't anything with Hyper IgM out there. Later on, there was an Australian mom that started a support group for Australia, and we kind of reached out to her right away and wanted to bring her together with us. So we gave her, she's like our patient liaison in Australia, and we've kind of joined the support groups together because with such a rare disease, you want to have one place. But I've made it a point to be active in the rare disease community, going to conferences, sometimes speaking at conferences. You need to make sure you always have a seat at the table so that you're there when you're meeting. I mean, so many times I've gone to a conference, if it's Nord conference or Global Genes, and I've met a doctor there that I did not know was focused or researching something that was relevant to what we are doing, and that's kind of how it developed. Another aspect is that I make it a point to also go to the medical conferences. So I'm not a doctor, but I have a background in public health, and so I've joined as a member. I go to their conferences, and not just as like an exhibitor, but I'm there to be at the discussions, be at the sessions, talk to doctors, and that's kind of expanded that network and led to a lot of the researchers that we end up meeting and focus on. Just by being at these conferences, I've connected with doctors that I would have never known, and then able to possibly help their research forward. So that's been really great.
That's incredible, and definitely echoes some of the other folks we've had on. Like we had Philippe Pachter, who I know I tagged you on his interview with Pierre Robin. He speaks at his conferences and connected me to people like Nick Thoreau, who I'm sure you know, and Durain Wong Reader. It's very interesting how similar a lot of these journeys have been, though the conditions are so different and the circumstances tend to be very different as to when people are diagnosed but there are core themes that I think we'd like to get across to our learners and anyone who's interested in the space. I know we're coming up in time. I want to be respectful of yours. What advice would you give more generally to our audience about working with rare disease patients and family members? How can they be most helpful, both to you all personally in the Hyper IgM Foundation and then the community as a whole, in your opinion?
I think for medical students and people that going through their training, getting involved with any kind of patient organization that is possibly connected to the passion of your, whatever you're planning on specializing in, would be an amazing benefit, because it would allow you to see a different perspective that's not just in the exam room and not just kind of like in the books that you're reading. One of Idan's immunologists from Seattle sits on our board, and we become very close friends. And I think that it definitely helps him in his own practice as an immunologist to be connected to these patients and kind of know their stories from a different side than just the white coat and the patient in an exam room, or just getting involved with any of the rare disease organizations. I'm part of a group called the Primary Immune Deficiency Treatment Consortium, which is mostly hospitals and research centers that all treat immune deficiencies, but they have the patient advocacy groups as part of it. So we're on their monthly calls where they're talking about their research trials and so on. We have our own monthly calls, and a lot of the physicians then participate in what we're doing and help kind of collaborate on the research projects we're doing. So I would say get involved with any kind of patient organization to kind of give you that perspective.
Definitely. I love that. And Nord, they have a woman there who's wonderful. Her name's Tiffany Salmons, and her role is to help develop rare disease chapters at medical schools. And some of these med students, like people like David Fagenbaum, who's now a professor at Penn, I'm sure you know him.
Yeah.
Jason McCure.
He's great.
He was a med student who got very involved because he had his own condition, Castleman syndrome. And so the more helpful I think Osmosis can be in helping Tiffany and others set up these chapters at these schools, it's very meaningful. I think, honestly, it's some of the most motivating work for me personally, in the last decade or so of Osmosis, because the gratitude, the heroic stories of these rare disease patients and family members like yourself and Amanda and Idan is palpable. And we would like to play a small part. We want to expand upon that. What other topics would you like, that I haven't asked you about, would you like to cover? Any other final words on your family story, on Hyper IgM, the space as a whole? And then if not, I'm also curious, kind of, you are more than a rare disease patient yourself and a parent of a rare disease child. What are the other things that kind of keep you busy? Are you still consulting for healthcare companies? Are you doing public health work, or is this kind of a full-time job for you right now?
I've focused now really almost full time on the Hyper IgM Foundation and just parenting, which parenting in itself it should be full time always. But when the kids are in school, you have time. So I'm focused on, helping our community and really trying to grow this organization to, a situation where possibly I could step back and it runs without. That would be ideal. I could still play a part, but it would be large enough that it would run also without my influence, essentially.
Yeah, that'd be ideal to keep growing, not not because, there's more and more people joining the foundation personally, but hopefully some organizations that are making breakthroughs. And one last thing, the hope is with any of these rare conditions that the research that goes under them elucidates some pathways or leads to a novel therapy that has even broader applications to anyone with, say, other immune disorders like, multiple sclerosis or other things like that. Any last words on maybe that potential, given how much you know about the research around hyper IgM?
So I know from discussions with the researcher out of UCLA that is focused on gene editing for X-linked hyper IgM, she feels that the work that she's doing, and hopefully does lead to a clinical trial with a CRISPR technique that would edit the gene and allow you to have a full, functioning immune system, because it's so specific and because it's like a specific gene that is not working properly and you could fix it. She feels that if they're successful there, it would expand to other types of diseases, because it's kind of like starting small with a specific one, but if they're able to do it well with that one and it turns on and it works well and it's regulated, then they would be able to expand to other ones. So I think that the funding that she got was, because it's kind of like a good trial on the science.
Let's hope that comes to pass. It's going to be very exciting to see what happens over the next decade or so. So Akiva, thank you so much, not only for taking the time to be with us on the podcast today, but more importantly for the work that you've done, for the rare disease space and for Osmosis and connecting us to the space.
Thank you.
And with that, I'm Shiv Gaglani. Thank you to our audience for checking out today's show. And remember to do your part to raise the line and strengthen our healthcare system. We're all in this together. Take care.
If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our episodes at osmosis.org/raisethelinepodcast.